Good day, class. You're welcome to our primary healthcare class. I'm Mr. Martins. I'll be the one taking you through this course. This is the continuation of where we stopped in the last class. This is a continuation of where we stopped in the last class. So we'll continue from. We've had discussion about what primary healthcare is. We've had conversation about the history of primary healthcare in Nigeria, and we've had conversation about the concept of primary healthcare. So we'll continue from principles of primary health care, which number one of it is equity of distribution. And this equity we're talking about has to do with the provision of access, providing equity in terms of making provision for the access of the primary health care service. Then this healthcare service also must be shared by all people with no preference for any individual as the case may be. And number two thing is that the community must participate in this primary health care service that is being rendered to the community. The the community individuals must participate with their finances. They also need to participate with the manpower, and their participation also includes the promotion of the primary health care services within themselves that is being provided for them. The third factor is that there must be intersectoral collaboration. I mentioned it in in our previous studies about the between interaction between the healthcare worker and the people that this healthcare service is being provided to. It is very, very important that we take note of this factor. It is very, very important. So, in continuation, primary health care was established mainly to bring it closer to the people at the community level. So, like I affirmed in previous class, that there must be a collaboration between the healthcare provider, which is our community health workers, and the community that the service is being provided for. So let's take a look at the role of primary health care. The first role is to make health service accessible and available to all people wherever they live or work. That is one of the factors that we started with when we were defining what primary health care is all about. One of the roles of primary health care also is to tackle the health problems causing the highest mortality and morbidity rate at a cost that is community friendly. That is community friendly. The the healthcare problems must be tackled in such a way that is community friendly, not when a particular procedure has been going on in the community. You were trying to reduce the mobility, the mortality rate or the morbidity rate, but is at the risk of another factor that is happening in the community. So you must ensure that this health problem being tackled in the community is not at the risk of the community itself. So number three factor you need to also focus on is to ensure that Whatever technology is used must be within the ability of the community to use effectively and maintain. Very, very important. You don't give you don't provide a technology means of health or health maintenance, as the case may be, to a particular community that you don't have appropriate hand that could take care of the gadgets. It will turn to a loss of or waste of resources, as the case may be. So let's proceed. One of the fourth rule of primary health care is to ensure that the implementation of the health programs in the community, um, it must be full. People must be fully informed, involved. The planning, the delivery, the evaluation of the services must be self-reliant. Very, very important. It's very, very important. So in some of primary health care essentials is aimed at promoting health, preventing disease, curing disease, rehabilitating people to live fully the kind of life that they desired to live, even irrespective of the illness that they've had or certain disability that they had in their body. I'll take it again. The sum total of primary health care is to essentially provide promotion for health, curing of diseases, preventing diseases, promoting health, and rehabilitation of people who for any reason had fell ill or has disability, so that these individuals can live a full and normal life that they deserved and they desire to live. So that will take us to local government area health systems. Local government area health systems. There are different systems that are set up in the community-based systems. There are different systems. There are systems that are peculiar to um, a particular state. There are systems that are peculiar to a nation. But don't forget that one of the epicenter of this primary health care is to make sure that the care service that is being rendered is actually direct to the community. So it's going to be, that's why you see that it is narrowed down to the community. So let's take a look at this local government area health system. It's one of the groupings. So I said that this is a self-contained segment of the national health system. I mentioned that there's a system for national, a system for state, the system for local. So it's part of the segmented area of the national health system being controlled by the Ministry of Health of each of the nation. So it comprises of a self-contained, clearly defined population living within a defined administrative and geographic area. What this system focuses on is that it's expected that at least a local government should have a population of about 50 to 5,000 people. A particular local government have a population of about 50 to 5,000 people. So this local government health system focus on making sure that this population is a defined population, and that's where the help of the census comes in. a defined population. Okay, knowing that okay, this is the number of young individuals, this is the number of adults, this is the number of females, this is the number of employed, this is the number of self-employed, this is the number of students, this is the number of people who are not in school, this is the number of elites, this is the number of non-elites, this is the number of people who are taking whose income are substantial on a certain percentage level of income. Very, very important because as we proceed in this study, we have the tendency to touch some part of this that we're going to discuss. It includes institutions and personnel providing health service, including the systems of their systems of referral. Their system of referral. Quickly, let's take a look at functions of local government area health system. Number one is the provision of basic health interventions. Provision of basic health intervention. Number two, provision of maternal and child health services. The provision of maternal and child health services. Number three, provision of medical care for the treatment of diseases and injuries. Part of the services is the provision of disease control systems. Disease control systems. Part of this system also focus on the provision of family planning, both the knowledge and the resources that are needful for family planning. Number 5 now is the provision of essential drugs. Provision of essential drugs. There are a few things we need to discuss about this health team. As the health team could be divided as a group of people who share a common health goal and common objectives that determines the needs of the community, based on the needs of the community, making sure that they achieve each member of the team contributes their own quota based on their competence and their skill in coordination of the function that is targeted towards the health goal that is postulated or formed through the health care policy available in that state or the country. So let's take a look at some things that need to be understood about this health team. And the health team must understand and communicate with the community. There must be an effective communication of the health team with the community. The health team must encourage community participation in identifying a problem and seeking solutions to the problem. So the health team must carry the community individuals along. There must be a participation. You don't just set up a project in a community to reduce a risk of a particular health condition or an outbreak that is happening in the community. The community need to be carried along with the procedures of reducing the prevalence of this disease in the community. The health team also must make sure that they are not working outside the community. The work must be within the community. They must have their meeting in the community. Their meeting place must be in the community. They must set up an health center in that same community that they are trying to help out or provide a primary health care service to. So to establish good relationship, they needed to establish a good relationship with the community. Don't forget I said that one of the most crucial thing is communication. So in proceed to you might ask that how do we establish good relationship with the community? I highlighted three different steps here. The first one that is the most important one. Yes, that is the most important one. Because if you don't do this number one, you won't be able to achieve any other thing you wanted to do. When it comes to relationship with the community, the first thing you need to do is you need to listen to the community. And the listening comes both verbal and non-verbal. You need to learn the community and you need to understand the community. You need to listen to the community, you need to learn the community, you need to learn about the community and you need to understand the community. That's when you now proceed to talking to the community individuals or the community members, discussing and making decisions concerning the health service that you plan to provide for this community. You need to encourage them and you organize them. Encourage them, you organize them, you put them through and help them to participate in the fight against the prevalence of the occurrence or the challenge, the health challenge that the community is prone to or might be exposed to. Let's take a look at the methods and steps using community diagnosis. Method and steps using community diagnosis. Number one, determine the object. The object in this case is the disease. Yes, you need to determine the object. Disease. Number two, you need to determine the study population. I've discussed something about the population the other time in the elementary of this class. I said that individuals make a community. I said the individuals make a group. The group of individuals make a community. The group of community makes a population. So that's the progression. So you need to determine the study population. The population of this community must be determined. Don't forget that before we got here, I mentioned about, I discussed with you about when we're talking about local government area health system, that the population of the area that you're dealing with or the community you're providing services for must be ascertained. It will help in your planning and execution. It will help in planning and execution of any of your services. So you also need to determine the data to be collected. Data to be collected in terms of your data collection method. So you need, if you have determined the object and you've determined the population, you know the parameters you wanted to collect. Maybe you wanted to collect their dates of birth, or maybe you wanted to collect age, their names, the peculiarity of the individuals you're talking about. Maybe they are students, maybe they are working class. Data that might be peculiar to the diagnosis you wanted to do for this community. Then the next step you take up is the collection of data. This collection of data can be verbal, can be non-verbal, and most of the cases there's always a documentation of, maybe you might need to use maybe questionnaire, or it might be a direct questionnaire that you are going to do a oral question or a written question depending on the kind of community you're dealing with. Then you need to develop instruments, developing instruments, the instrument you're going to use to collect your data. Then you need to gather the actual data. When you're doing data collection, there are going to be visible data, there are going to be data that you needed. Then there's something we call data sorting. Yes, there's something we call data sorting. You have used the instrument that you're using for your data collection to sort the data that you need, the needful ones that you need for your data collation. So after you've act your actual data, you've done the gathering of your data, the next step you move to is data collation. Then after that you summarize your data, then you do data presentation, and the last step, which leads you to implementation of the data collection, is the data analysis. You analyze your data through any data analysis method that you have chosen to data analysis method that you have chosen to use. So taking it further, when we talk about data collection, or when we have conversations about disease prevention and control, don't forget that that's one of the things that this course is all about. We discussed it previously. You realize that there's a need for us to understand the community very well. Because if the case is not understood, the problem will not be, there won't be a way to resolve the problem. You need to understand problem before you start thinking of providing solution. That's what will lead us to source of history. Now, this source of history varies. The history will aid your data collection. Are we together now? So there are different kind of sources. You can source from your patient, you can source from the family, you can source from friends, you can source from the police, you can even source through the letter of referral, or you can source from a past medical record that has been made about the community. It's about the community. So we can have such something like clinical history of the adult patients, and it could be from the previous admissions. Yes, previous admission of such case that has happened. Maybe it's an epidemic, or maybe it's an endemic condition, or it's a pandemic condition. The previous, if you've had cases like that before, you can check the clinical history of previous people who had been admitted on that occasion. You can use chief complaints to narrow down the history of that occurrence, in that maybe certain complaints has been consistent in a particular area. Then the history of present illness, the history of past illness also can be used. The functional inquiry, which is the systemic review, or personal social history, can also be used in navigating through your data collection, understanding the problem of that community, and providing solutions to the outbreak of disease in the community. The family history also, be very, very needful. So, I think I've discussed some of this. Just follow me as I showed you through, so that you read. I've actually explained them. I've explained those factors. I've explained the chief complaints, the major symptoms that are prevalent in the patient that's seeking advice. Can you see now the history of present illness? It will help your data collection. The history of past illness to help your data collection. The systemic review, which involves which gives you a clear understanding of the present illness. It will also help you to check the history of the present illness if it has happened before. It will also guide you to concentrate on specific systems during the physical examination when the matter is an emergent case. You see the social history, maybe a background story or conversations that be peculiar to a social history of a particular community can give you an insight or a picture to interpret the condition of the community. So these are essential things that you need to master that will help your data collection in primary health care services. Then I'm going to round it up on this factor, and I'm going to discuss with you recording and reporting. Recording and reporting. You realize that we've been following through about conversation on putting together details, putting together informations, from the community, so that it will help us to track the occurrence that are peculiar to the community, the challenges that are peculiar to the community, and how these matters could be addressed. So let's take a look at recording and reporting. I said records are information kept in health units in the work of the unit on the health condition in the community, on individual patients, as well as information on administrative matters, staff, equipment supplies, and etc. Usually records are written information on notebooks or in folders designed for different purposes. So some of this record can be computerized and can also be kept in maybe notebooks or paper documentation, because the healthcare workers can't keep the history or the details of every patient. So it's best that they are properly documented. These records is an important tool in controlling and assessing the work that's been done so far in a particular community. So it will also help, in supervision also, to know how far has the healthcare service that has been provided for this community, how far has it worked, what has been the improvement over time, what is left to be done, how far has the procedure help, the processes, has it been helpful, has it reduced the prevalence of the disease, do we still have more cases to go, were there shortage of resources when there's a distribution of this healthcare service in that community. So it will help to make effective decision It will also help in assessing progress towards the goals, the earth goal that have been set. It will help in providing an insight for the planning of purposes. Maybe um, they were resistant in providing the healthcare service. It will help to re-strategize or re-navigate in provision of the healthcare service in that community. So that's where we're going to round it up for this course. Um, do well to ensure to read up, and you can also rewatch this webinar, this class again, to have a full understanding of what we've discussed so far. Thank you and have a wonderful time.